HealthLine, we will eventually get with you. Dr. Parent, I want to go back to LASIK and refractive lens exchange. This isn't going to eliminate, or will it, the need for glasses?
Well, in many cases it does. In over half the patients, the refractive lens exchange can eliminate the need for glasses for a lifetime. Some people still use glasses a little bit to drive or a little in dark light, you know, where they say, I can just see slightly better with glasses. But in most cases, these individuals, over half, just say they don't wear glasses anymore. And it, as I say, it's the same thing. It's just essentially like a cataract removal with a multifocal lens implant. And we're also working on new lenses. We're working on different lenses, maybe that will accommodate and actually move inside the eye. And instead of having rings that allow you to see like a bifocal, it'll actually move like your old lens when you were young. Can you remember that, Mark?
Oh, I remember that many years ago. Yeah. All right. And we've got Phil on line one. We'll get to him in just a second. I do want to ask a question regarding refractive lens, the difference between a monofocal and a multifocal lens.
A monofocal is what we call a standard lens, and it's literally the lens that the government says, I'll pay for this lens. It's a less expensive lens. It doesn't have all the development that a multifocal lens or a new accommodative lens will have. So the government says, I'll pay for that, but if you want a lens that allow you to see at distance and near, in other words, when your cataract's removed, if they say, if you want to be less dependent on glasses, the government doesn't care. So they make you pay for that specific upgraded lens. And some people call it a smart lens. Some people call it a premium lens. There's all sorts of different names, but they're all the same lenses made by companies in the U.S. That lens itself allows you to see better at distance and near, and in many people intermediate. The girl who actually schedules all my surgery was thinking about having LASIK. She elected to have, at 38 years old, she elected to have the multifocal lens because she said, it's a lifetime fix. And she doesn't want to just be fixed till she's 45 and wear the half glasses around on her nose all the time. So.
Right. Okay. All right. Well, thank you so much for that. We'll go to line one now with Phil. Phil, thank you for calling. Your question, please, for Dr. Parent.
Yes, I was told I have cataracts, and when they called to schedule the surgery, they asked me which lenses I wanted. I said, well, whatever the doctor recommended, which was toric. And she told me, well, they're not covered by the insurance company. They're $1,200 a piece. What do you think of toric lenses, and does the government cover them?
Well, I think that toric lenses are a good option for certain people. Fortunately, we provide toric lenses less expensive than almost anybody, and it's certainly less than $1,200 a piece. But that doesn't mean that the person, you know, what they're figuring is all the work it takes to do things. And we just do surgery all the time, so we may be able to do it a little less expensively. That explains the money. But yes, you have to pay out of your pocket. This refers to things like the multifocal lens. And as far as the toric lens itself, you can, if you feel a little insecure, you can always get a second opinion and say, do you think a toric lens is best for me? Or do you think a multifocal lens is best for me? Or what do you think is best for me? Maybe just a regular lens. In many of my patients, I recommend a regular lens, and we use a thing called astigmatic keratotomy or corneal relaxing incisions, and we can correct a small amount of astigmatism without paying that extra amount. But in certain patients where they have quite a bit of astigmatism, a toric lens is a real good option. But as you were told previously, a toric lens is not paid for by the government. It isn't paid for by any insurance company, just like refractive surgery. They don't pay to fix your eyes. They'll pay maybe to get you some glasses, but they aren't going to pay the surgical fee to fix your eyes so you don't wear glasses.
They'll take care of pretty much the basics.
Yeah, what you were told is true, but you know, you can also shop around for prices.
Right. Okay, well, thank you, Phil, for that call.